My name is Jennifer Booth, and I'm a student physical therapist assistant. And today I'm going to be taking a look at a research article done by Schreiber regarding adolescent scoliosis. So just for a little bit of background, scoliosis is defined as a lateral curvature of the spine. And the reason that these researchers did this particular trial is because in most cases the standard plan of care for a scoliosis patient is just observation of the spine, or maybe in some cases a brace might be put on, but generally physicians don't always prescribe exercise and physical therapy. So the researchers just wanted to find out a little more information about whether or not there was a link between therapeutic exercise and slowing the progression of the curve. As this study is looking at adolescent scoliosis, that means that all of the participants in the targeted patient group are going to be under 18 years old. In the particular case of this trial, all of the patients on average were 13.4 years old. And the reason such a young patient group was targeted is because it's been found that once a patient reaches skeletal maturity, generally a curve under 30 degrees really isn't going to progress anymore. So these patients are in sort of the best age range to try to treat the condition. As far as the research methods go, this particular study was done with 50 participants, and among those 50, they were randomly split into either the control group that just continued with observation or bracing, whatever their physician gave them, or the other 25 were randomly assigned into the therapeutic exercise group. And with that group, what they did was for the first 2 weeks, they went 5 times a week to private 1-hour therapy sessions where they performed their therapeutic exercises, as well as having a home exercise program. And then after those 2 weeks, for the remaining 6 months of the trial, they went twice a week for 1-hour group sessions and then continued with their home exercise plan. The results of the study were measured by looking at the largest Cobb angle in each group, as well as the sum of the curve in each group. So the Cobb angle is measured through X-ray imaging, and that lets them get a very specific and accurate number for their measurements. But at the end of the 6-month trial, what they found was that in the control group, 14 of the 25 patients remained stable, so there wasn't really a change in their curve one way or another. There was 1 who improved, and there were 10 patients who deteriorated, which means their Cobb angle got larger. And in the experimental group, there were 18 who remained stable, 4 who improved, and 3 who showed deterioration. So by looking at these results, it seems as though the experimental group had better results than the control group did. Even though the results of the study were good, as I was looking through the paper, I did find a number of weaknesses and limitations that I wanted to talk about. So the first one, as I mentioned before, of the 50 participants, 47 of them were girls and only 3 were boys. And we do learn in the paper that scoliosis is more common in girls, as well as more likely to have a larger curve angle. So they may have had just a harder time finding boys to participate, but that does mean that it can skew the data a little bit. Another limitation is that with a trial like this, there is no way to blind the therapists or the participants. So of course everybody knew what group everybody was participating in. And then a third weakness I found is that there were a total of 4 dropouts out of the clinical group. And I think the reason behind that is just that they were kind of asking a lot from the participants, especially because, as I mentioned, they were on average just 13.4 years old. But, you know, for the first 2 weeks, they were going in for 5 hours a week in the clinic and then doing a daily 30 to 45 minute home exercise program. So they're quoted in the paper actually as saying that they dropped out due to time constraints due to homework. So I think they may have just been asking a little bit too much from the clinical group, especially compared to the control group. Overall, the study design was pretty good, but I don't think that the results are very widely clinically applicable. And the reason for that is it was such a narrow population that was studied here, being that 94% of the participants were girls. And then on top of that, the age range also was pretty narrow. That unless you're working with the patient who happens to fall into both of those categories, these results really aren't going to apply to the patient that you're working with. However, I do think that this study is a good starting point. I think it opens up the door maybe to have some more research done just to see if these results maybe apply to other populations than just the ones done in the study here.